So this bone is the femur. It's our big thigh bone, carries a lot of weight. It forms a ball and socket joint at the acetabulum of the os coxa. So what we're going to do with the femur is we're going to turn it to this view, and we're going to look at the proximal end first. So with the proximal end of the femur, I'm going to zoom in here with my camera so we can get a little closer in. So be patient. Here we go. Zooming in. So on the proximal end of the femur, just like the humerus, we have a very round, almost ball-like femoral head, and the neck is very pronounced here. We also have sites of muscle attachment just like we do in the humerus, except this time instead of tubercles, we're going to call them trochanters. So the greater trochanter is on the lateral side, and the lesser trochanter is on the medial side. Greater is bigger, less is smaller. And if you flip over to the posterior view, so here's greater trochanter, here's lesser trochanter, you have a little crest, a little ridge of tissue in between called the intertrochanteric crest. And again, from the posterior side, here's the head, here's the neck. Now the shaft, just like we've seen in the other long bones, the diaphysis, there's no really features that I want you to be aware of on that. On the distal end, you can see some smooth condylar surfaces. This surface is smooth because it articulates with the patella or the kneecap. This is smooth and this is smooth as it articulates with the tibia. So the smooth surfaces are known as the medial and lateral condyles. And again, the side of the head of the femur is on is always medial. So medial condyle, lateral condyle. And just like we saw with the humerus, superior to the smooth condyles, we have a rougher epicondyle on top. So lateral epicondyle, medial epicondyle. And if we flip over, we can see our lateral and medial condyles a little bit more clearer. And then we see that in between the two, we have a little depression here called the meaning between, condylar fossa, so the intercondylar fossa. And this is where some important ligamentous components of the knee are going to be found within that joint.